How does ultrasound therapy, compared to no ultrasound therapy, affect pain in people with carpal tunnel syndrome? And this is by me, Alex, Kara, and Alexa. So, what is carpal tunnel syndrome? Carpal tunnel syndrome is caused by a compression of the median nerve and one of the most common nerve entrapments. Common complaints include paresthesia, sometimes with or without numbness in the fingers that are innervated by the median nerve, and weakness in thumb abduction. This is a very painful condition because the pain is mostly at night and can interfere with normal sleep routines. Although there are many invasive ways to treat carpal tunnel syndrome, non-invasive treatment options like ultrasound therapy are not well supported in research and need to be examined more, especially the biophysical effects on the tissues. So for standard treatments of carpal tunnel syndrome, these include like splints, those injections of corticosteroids, a surgical decompression. Many people do benefit from carpal tunnel surgery. However, this is limited and not all patients respond to surgery. So we do need to come up with some intervention that is not as invasive as surgery.
So now just a little bit of information on what ultrasound therapy is. So ultrasound uses sound waves to penetrate soft tissues to provide relief to painful conditions as well as promoting tissue healing. And these sound waves are going to be produced from the little device you see here in the picture. And although evidence exists about ultrasound therapy's pain relieving qualities, evidence is still mixed about the benefits of pain relief. In order to answer our PICO question, we're going to start out reviewing a systematic review, which was titled Therapeutic Ultrasound for Carpal Tunnel Syndrome. So now we're going to talk about the purpose and methods of the systematic review. So when comparing the effects of ultrasound therapy versus no ultrasound therapy on patients with carpal tunnel syndrome, ultrasound was offered to those who had mild to moderate symptoms of pain. The systematic review is conducted and studies were selected to assess for risk of bias and informational data by 2 review authors. From the databases, 11 studies were included in this review, which consisted of a total of 414 participants. These studies were gathered from databases such as Central and Medline. Of the 11 studies included, only 2 studies revealed short-term improvements, which are the 2 listed below. So of these 2 studies, the first one was a low-quality trial that revealed that 3 months post-treatment therapeutic ultrasound plus splint increased the chance of short-term improvement in pain when compared with just splint or ultrasound alone. This study concluded that ultrasound therapy combined with another intervention had a more positive effect than just either alone. The second study listed revealed that when compared with the placebo, ultrasound may increase short-term improvements. This study should be interpreted with caution, though, because there were no follow-ups and failure to adjust the correlation between the risks of the patients. Now we're going to look at the results and conclusions of the systematic review. So overall, there was only poor quality evidence that suggests therapeutic ultrasound used alone may be more effective in symptom improvement, such as in patients with carpal tunnel syndrome. Of the 11 studies extracted for this review, the conclusion gathered supported that there was insufficient evidence to support the use of therapeutic ultrasound as a treatment alone with greater efficiency compared to other non-surgical interventions such as splinting or exercises. The main takeaway from the systematic review was that ultrasound therapy may be more beneficial when used as an adjunct to manual therapy or exercise instead of as the primary treatment. Overall, more studies are needed to determine the effectiveness and safety of therapeutic ultrasound performed alone for carpal tunnel syndrome.
This study, conducted by Archives of Physical Medicine and Rehabilitation, investigated the therapeutic effect of using repeated continuous ultrasound on patients diagnosed with carpal tunnel syndrome, testing the parameters set at different intensities compared to a placebo-controlled group. This slide details the methods used for this study. All 18 participants were blinded before and after the 2-week-long treatment trials. They were randomly divided into 3 groups, with there being differences in the intensities in each. The first at 1.5 watts per centimeter square, the second at 0.8 watts per centimeter square, and the third at 0, which is the placebo group. The 2 of these aspects of the study give it strong evidence. Of the two evaluations that were completed, the first was done clinically, utilizing a pain verbal analog scale and questions regarding night pain and frequency of symptoms. The second was an electrophysiological test for motor and sensory distal latency and for motor and sensory nerve conduction velocity. They were completed on the median nerve. Both evals done before and 5 days after the final treatment. And the statistical analysis was calculated using a one-way ANOVA. The results of the study showed that even though the electrophysiological test failed to reveal statistically significant differences, there were minor differences between the group A and group B noted in the motor distal latency and the motor nerve conduction velocity. There was, however, statistical significant improvements in all three groups regarding the pain, paresthesia, and the frequency. This included that placebo group. This is a significant bias limitation in the study and an important finding concerning the actual efficiency of the ultrasound aiding in the treatment of the carpal tunnel syndrome. And so to conclude, this study demonstrates strong evidence comparing treatment from a therapeutic ultrasound to a placebo treatment, with significant improvements for symptomatic relief, specifically pain, and this decrease in motor nerve conduction.
So the study that I chose is ultrasound treatment for treating the carpal tunnel syndrome, randomized sham-controlled trial. This study was done in Vienna, so the names are a bit odd, but they're listed on the PowerPoint slide. So the purpose of this study was to see the efficacy of ultrasound treatment for mild to moderate idiopathic carpal tunnel syndrome. This is a randomized double-blind sham controlled trial with assessment of baseline after 2 weeks and 7 weeks of treatment and a follow-up at 6 months. There were 45 participants in this study, and they all have mild to moderate bilateral carpal tunnel syndrome. This study investigated the efficacy of a pulse mode setting, that's a 1 to 4, with an intensity range of 1 watts per centimeter square and a frequency at 1 megahertz. The transducer head was 5 centimeters squared. The gel that was used was an aquasonic gel for a coupling treatment, and the ultrasound lasted 15 minutes per session to an area over the carpal tunnel. 20 treatments were performed in total, 10 treatments performed 5 times a week for 2 weeks, and the last 10 treatments were twice a week for 5 weeks. There were several aspects that made this study strong. The first one was that the researchers excluded patients in the study like secondary entrapment neuropathies, systemic diseases that cause an increased risk in carpal tunnel, signs of axonal degeneration of the median nerve, if the patients had surgery already for relieving their symptoms of carpal tunnel, and if they had history of steroid injections for their carpal tunnel, if they required an analgesic or inflammatory drug. So overall, the results of this study showed an improvement of the average score of all the ratings in the patient's symptoms. It was more noticeable in the experimental group after the second week, and also in the end of the treatment and at 6-month follow-up. This coming directly from the study, satisfactory improvement or complete remission of symptoms was observed in 68% of the risks receiving active treatment versus 38% of those receiving the sham treatment at the end of the treatment series, and in 74% versus 20% at the 6-month follow-up. So the evidence is strong that the ultrasound treatment has an effective short-term to medium-term results in improving pain and symptoms with people with carpal tunnel syndrome. The researchers of this study also acknowledged that there's more research that needs to be done to confirm that these are the true results. They also noted that they need to find an optimal treatment schedule and find out if this method works with surgical treatments as well, since those patients were excluded from the study. As far as limiting symptoms, there is evidence that ultrasound limited the patient's symptoms because almost double the patients felt relief at the end of the treatment series. and 74% of the treatment group still felt relief at the 6-month follow-up, compared to only 20% in the sham group. So some of the main outcome measures used in this study were the score of the subjective symptom ratings assessed by a visual analog scale, and then electroneurographic measures, for example, like motor distal latency and sensory antidromic nerve conduction velocity.
Altogether, considering the 3 studies, our clinical bottom line is that ultrasound has a positive effect on limiting the pain in carpal tunnel syndrome. Each study had its limiting factors and some had biased outcomes, so further research and testing is still needed to confirm the results. But it did show that in conjunction with other therapies with the ultrasound had fuller benefits. Each study also had different parameter settings, so this still needs to be investigated to determine the optimum schedule of treatment. Thank you so much for your attention. The next slide is our references. Thank you.